Hi, good afternoon. My name is Carrie LaViolet. I'm Senior Vice President of Government Affairs for NCPA, and I'm joined by Rana Hauser.
I'm the Vice President of Pharmacy Affairs for NCPA.
And we want to give you a little update on our efforts related to the HHS request for information on drug pricing. So I'm going to have Rana just give a little overview of how we got there, and then I'll go over sort of efforts we made with members in the grassroots arena on our efforts there.
Sure. Back in May, President Trump announced in a Rose Garden ceremony plans to lower drug prices. It's a top priority of his administration. And after that meeting occurred, the Department of Health and Human Services did put out a request for information and asked several very pointed questions on how to lower patients' out-of-pocket cost, how to lower drug prices in this country. The main areas that NCPA focused on were questions related to the rebate system that currently exists between PBMs and manufacturers. Should that rebate system still exist, or should those rebates be passed through to consumers at point of sale, and how should the whole process work? NCPA was very vocal on that issue, and then we also weighed in on the issue of a question of whether PBMs should serve as fiduciaries for those who they manage pharmacy benefits.
And so, thanks to many of you watching this video, as Rana said, our main focus is the DIR fee issue, which is our members' number one issue, and we took this as an opportunity to comment specifically on that and get some grassroots support behind that. We were able to get nearly 2,000 pharmacies to submit comments, which was great. I think the total was maybe 3,500 or so that they had total, maybe closer to 4,000. So great grassroots effort, and thank everyone for doing that. We also had a stakeholder letter where it wasn't just NCPA talking about this issue, where we had over 150 different stakeholders, several buying groups, wholesalers, health systems, grocers, in support of this effort as well. So that was great. We had, I believe, 153 total signatories on there. I think that probably covers it, other than what's going to happen next. So the filing period was the 16th.
Yeah, we submitted our comments on July 16th. All of the efforts, all the comments that you guys submitted, over 2,000 pharmacists, all of the comments that NCPA submitted, our stakeholder letter, really focused on our top priority, our key priority, which is eliminating DIR fees. If the rebate system that currently exists in the Part D program changes, i.e. if rebates go away, and if there are no longer rebates between the manufacturers and PBMs in the Part D program, we would ask that HHS also do the exact same for pharmacy price concessions or pharmacy DIR, that it be eliminated, number one. If the rebate system does remain in place, we are asking that all pharmacy DIR be accounted for at the point of sale so that patients can immediately experience lowering of drug prices at the pharmacy counter. I'd say what's next is we've already seen an announcement just a few days ago, last week, from the administration, from Health and Human Services Department, that they do plan on proposing a rule that would look at the rebate system and potentially changing that system, potentially eliminating it. We don't know much more at this point. We will keep our eyes open for that. And then we also anticipate this fall seeing a proposed Medicare Part D rule that would go into effect for plan year 2020. In essence, it would be worked through later this year and next year to get to a final rule. We absolutely hope that our DIR issue is addressed and resolved in that rule.
And I will say, in addition to our work with the administration, many of you have been very helpful in getting congressional attention on this. So we had a Senate letter that was sent to HHS on the RFI dealing with DIR fees, where we had 21 senators sign on to that. And just this Friday, there's going to be a House letter that closes, and we're well over 50 members of Congress on that letter right now, but there's still, we still have more time to get more members on. So we continue the congressional pressure as well as the administration pressure, and hope through both of those efforts that, we'll get some relief sooner rather than later. Thanks.
Yeah, thank you.